Here's a very brief case of someone with neck pain, and I know it's brief because I only saw this patient one time. After I'd seen her, she reported after 6 days her pain was gone and reported via email that she was happy with where she was, being able to self-manage. So here's her case: left lower neck to shoulder blade pain, central upper back pain, paresthesia to the left elbow. Symptoms are all intermittent. It's been episodic for many, many years. This episode had started 3 weeks ago for no apparent reason, and the present pain at rest in my office was 4 to 5 out of 10 on that left side. She had already seen, I believe, a primary care physician who had given her steroids and muscle relaxants and said that it would be possible that she would need an MRI in the future. So her verbal history was pretty quick. Sitting could make her worse, walking could make her worse, but it wasn't anything that was extra special in terms of the verbal history with mechanics. So her range of motion of her neck: protrusion was full and decreased her symptoms. Flexion was full and decreased her symptoms. Retraction was full. Extension had a minimal loss and with a very mild deviation to the right. Right side bending had minimal loss and increased her symptoms. Left side bending had a min or nil loss. Right rotation had a minimal loss, which increased her symptoms. And left rotation had a moderate loss. So of these, the biggest two that jump out to me are the moderate loss of left rotation and the deviation with extension. Now, you could make the argument that because protrusion and flexion were relieving, that you could start repeated movement testing there. And you could, but I find a lot of people have relief when they take pressure off the posterior aspect of the joints. Just like so many people love to do child's pose for the low back because it is relieving in the moment. But in my experience, it's the therapeutic exercise that we need very rarely. Like under 5 to 10% of times do we need to move the spine into more protrusion, flexion, because that's the position we're in almost all of the day to begin with. Strength testing of our upper extremities: 5 out of 5 for shoulder abduction, flexion, ER and IR, 5 out of 5 for elbow flexion and extension, 5 out of 5 for wrist extension and thumb extension. So that was basically my physical exam. Then I started my third part, which is repeated movement testing. So based on prevalence and based on my experience and the knowledge that we should start in the sagittal plane if there's no obvious deformity, I chose to start with retraction extension. This is in contrast to retraction alone because I thought we needed to really get to the lower cervical spine to end range extension. So she did 3 sets of retraction extension, and it hurt during, but it didn't remain worse after she did these sets. So when she got back to sitting and normal, the pain was still 4 to 5 out of 10. But when I rechecked her baselines, the deviation was gone and the left rotation was only a minimal loss. So I'd seen a significant improvement in the mechanics with just 30 retraction extensions. And then that became the home program to do 10 retraction extensions every couple hours. And because this is such a kind of straightforward and limited in scope evaluation in terms of mechanics and repeated movement testing, we spent a lot of time talking about the probable exacerbation of this neck pain from postural choices. So we talked about the car and the office and home, and how what often happens with patients is over the course of years, tons of looking down over books, laptops, desktops, and phones can cause these joints to get tweaked, what I would call a joint derangement if it's fixed with specific movement, which is what this one was. And that tweak can be resolved by creating some balance in the spine, which often includes doing some more extension, either once a day or twice a day or once a week or whatever that person needs to keep that spine moving well and pain-free. So her diagnosis was joint derangement because repeated movement in a specific direction fixed her pain. I didn't have a chance to reassess the baselines on a follow-up visit. Again, she reported via email that she was doing great and didn't see the need to meet again. She knows that I'm here if anything comes up. I gave her the Treat Your Own Neck book, which goes through the exercise and the philosophy and has a page on how to self-treat if symptoms arise again and you don't want to go to a medical professional. But repeated movement in a specific direction for her is all this problem needed, despite it being episodic over the course of many, many years, and in spite of it being significant pain. It wasn't a muscle problem, it wasn't weakness or tightness or something else. And honestly, when it comes to spine disorders, I'm basically finding it at least 75 to 80% of the time, it's a joint derangement that needs a specific movement to get better. Sometimes it's inflammatory, and sometimes there are structural problems or degenerative problems that require different treatments. But it's amazing to me to think of all of these different diagnoses that clinicians are coming up with when I really just see those kind of three big buckets where 75 to 80% of problems in the spine, which can present just with elbow pain, right? Or just calf tightness, but it's a spine problem. At least 75 to 80% of these spine problems just need movement repeatedly throughout the day to get better into a very specific direction.